Hello, my name is Rich, and I'm going to be showing you how to administer an IV fluid medication. So the first step that we're going to do is we are going to check our EMR because an IV fluid is a medication, so we want to verify our patient's name, date of birth, allergies, and of course the physician written order. Once you've verified your orders in the EMR, you're going to go ahead and gather your supplies. To your left, you have the IV fluid, which per my order is 0.9% sodium chloride. Then we have our IV tubing. You have the one on the left. This one right here is the primary tubing, and that is what we're going to use today with our saline bag. This IV tubing you'll see in the stockroom as well, but it's for secondary tubing, and you can tell the difference because it has this blue hook in it. So we want to use the primary for our primary bags, and again, it does not have that blue hook. Next, we have alcohol swabs, and then we have a label here, which we'll need to fill out with time, date, our initials, and that is to put on the IV bag so we can identify it. And then we also have a label here, which is what we'll put on the IV tubing itself, and that will just demonstrate, again, the date, the time, who hung it. Therefore, other prior nurses that come in and evaluate the tubing will know per the facility's protocol when it's time to be changing that tubing. You also need gloves, and then of course you also need a saline flush, which we'll use to make sure that we have an IV that is patent before we hook up the tubing. So I've prepared the labels both for the IV medication and the IV tubing. So the top one, the orange one, is the one that we're going to place on the IV primary bag. And again, it has the patient's initials, the drug, the amount, my initials, the date, and the time. And then the one below is the one that we're going to attach to the IV tubing. And again, it has my initials, the date hung, and then of course the time. So I'm just going to go ahead and just rip just like that. And again, you want to make sure there's no leaking, nothing going on. And then of course it also has a barcode up here. Again, it's a medication, so we're going to scan this as well. On this IV bag, you're going to want to note these two different ports. So you can see you have the blue tab and then this other tab right here. So this one is going to be for if you need to inject additional medication, you can inject it through this port. Not something we do regularly, and we won't be doing it during this demonstration. This blue portion is the portion that is going to be where we spike the bag using our tubing and therefore hook it up and get it set for the patient. Okay, so now we're going to head and prepare our IV tubing so we can go ahead and spike our bag. A couple things that you want to know before you do this is you have this plastic tip here, and that is covering the spike of the tubing. So you want to keep that on to make sure you're maintaining sterility during your priming process when you're first starting out here. I don't know if you can see that little mark right here, but this is called the drip chamber, and that is how high we're going to want the fluid to go in. It's about 1/4 of the way up. A couple other important pieces you'll want to note on this tubing. You have these right here, which are ports which we can inject medication into. You also have a couple different clamps located on this tubing that you want to make sure are open or closed depending on what you're doing. The first one that I want to show you is this dark blue one, okay? And basically, if you push it this way, it clamps the tubing so nothing can go through. If you move it in this direction, then of course the fluid can go through that direction. This is also going to be the key for our IV pump. So you want to move that when you open up your tubing. You want to make sure you're handling it with sterile as much as possible. So you'll want to move that one closer to the top as we use it for the key. The other thing you'll want to note is this clamp, and this clamp is called a roller clamp. And right now it's in the full open position. The wheel's at the part closest to the front with this part here. And for this to work, we basically will just take our thumb and move it backwards. And then what it does is it compresses the tubing here and will not let any fluid run out. So this is going to be our main controller when we're priming the tube, because right now it just came fresh out of the bag and it has a lot of air. It's all full of air, and so we cannot hook it up to the patient in this way. So what we have to do is spike our IV bag and then run some fluid in through here and get out all the air bubbles before we can hook it up to the patient. So I'm going to grab my IV bag, and you want to make sure before you do this that you have your clamp in the off position, because you don't want all that fluid running out. So what I'm going to do is I'm going to take this blue tab. Again, this one is for medication, and then this is going to be the one where we're going to actually spike the bag. So we're going to go ahead and just pull this off, just like so. And then we will have our drip chamber and spike. So now we can remove your plastic, and then we're just going to go ahead and insert this in here. And sometimes you just got to twist it down. And then we're going to tilt it up like so. And then we're going to give it 2 squeezes. And that way we get it to that line that we wanted to. So it's about quarter filled. And then we're going to continue to prime our tubing. At this point, I like to utilize, and this can be done in the patient's room, or it can be done in your medication preparation room as well. So the very end of your IV tubing, you have this little blue cap. I tend to leave it on because we want to keep that portion, which is going to be hooked up to the patient, as clean as possible. But to let a little bit of liquid out while we're priming this, I just twist it a little bit so it's a little bit open. That was a little too much, but now it's open. So then I'm going to take control and make sure you have this in your hand to control it, because we don't want to be flinging this around and let it touch the ground and get contaminated. Okay, so now I just want to show you the port here. And so now I have my hand, and I'm going to release some of the pressure in that roller clamp, and the fluid is going to start draining in my IV tubing. Okay. Now, I like to flip them upside down like this, because if sometimes the air bubble will get trapped in there. And so then I'll kind of flick it, and then we created a slight little air bubble there, right? And so we want to flush that out, continue to flush it. So I'm just going to step back a little bit here. And again, I'm holding this to make sure I have control of it. And what you're doing is you're looking for the last little air bubble in the tubing, and you're just going to follow, which is right here at this present moment. And we're just going to follow that air bubble down to make sure that it gets eliminated through that blue tip. So it's making its way down right here. It's passing my clamp. All right. And then you might get a little bit of liquid coming out of your blue tip, so you can hold it over a trash can or a sink as it's going. All right, so now my last air bubble has gone through. So then I clamp my roller clamp, move it back into the tight position, and then I'm going to inspect my tubing one last time to make sure that there is no air bubbles in the line. It appears that I do not have any. Perfect. And then again, I kept my little cap on. And so now, and this is what we would hook up to the patient here in a minute here. Okay, so now we've primed the tubing. There's no air bubbles, and that's what the goal is to get rid of all the air bubbles. So that air bubbles are gone. As you can see here, I have labeled my IV bag, and you want to label it on the back because you don't want to label it on the front, because it can hide what the fluid might be. So you want to put it on in the back. Once I have done this correctly, now I'm ready to enter the patient's room. But before I do that, I do have to make sure that I put that label on the tubing for to make sure we're following our facility protocols. So I'm going to do that, and then I'm going to head into the patient's room. So now we're in the patient's room. I've knocked and I've done my hand hygiene, and I'm going to approach my patient, who is Mr. Alan Covey. So I'm going to ask him his name and date of birth. He verifies that for me. I'm going to ask him if he has any allergies. It appears he has shellfish and iodine. So I'm going to come over here and verify that for myself. And again, I have his name, date of birth, and his allergies. And then I'm going to compare that with my chart. And this is my second check of my medication. So now I'm in my EMR. And it looks like I have that sodium chloride. And we're going to run at 100 mils per hour. And it's 1 liter, which is what I have. So now I'm going to explain to Mr. Covey that his doctor has ordered this medication for him. Give any patient education that's needed. And before I hook him up, the one thing I need to do is I need to check his IV to make sure it's patent and there is no issue with that. So I want to assess that IV site for both redness, swelling, or tenderness. So to do that, what you need to do is you need to have your saline flush, which I just got out of the package. There's a little bit of air, so I'm going to get that air out. Perfect. And then I have my alcohol swab. Okay, so now I'm going to show you how to hook up the IV. So we have our port here, and then we want to make sure that we're going to do a really good job of cleaning this. And then I have my saline syringe here, and I'm going to make sure I got all the air out here, and I'm going to go ahead and do a little flush. Again, making sure that there's no redness, tenderness, there's no pain, there's no difficulty pushing this fluid through, no complaints by the patient. I'm also going to draw a little bit black to see if I get blood return. I do get some blood return in my IV, and which is great. So I have a very patent IV. So then I'm going to unhook my saline, and you can go ahead and flush it with all 10 there if you'd like. And then I'm going to hold this, make sure that I don't contaminate that now that I cleaned it. And then I have my IV solution. Again, I'm going to open another IV or alcohol swab. I'm going to clean it again one more time before I hook it up to my patient. Then I'm going to take off my cap, being sure not to contaminate it. And then you just stick it on into the port, and then it screws on. Okay. And then you'll leave it and make sure that it's attached to the patient nicely. And then now it's hooked up to the patient and scan the patient. So again, I'm gonna do my third check right here. Alan Covey, birthday, allergies, I've scanned him. Then I'm gonna scan the barcode of my IV. Perfect. I'm gonna make sure I do all my 6 rights of the right drug. Right patient, right dose, right route, right time. And then I gave him his education. Completed my 3 checks.